Hello, my name is Dr. Audra Rankin. I am the National Health Policy Chair for the National Association of Pediatric Nurse Practitioners, and I am so excited to be with you all tonight as we talk about why voting matters for kids. So I'll give it just a minute or two longer for more folks to join, and then we'll get started. All right, so tonight we're going to spend a little bit of time talking about the importance of voting and how that relates to our work as healthcare professionals. So we know that Healthy People 2030 named voting participation as a core objective of our country's health goals. And so, that's really important because that means that it's a high priority issue that we need to focus on because there's direct links between voting and overall health and well-being. The Office of Disease Prevention and Health Promotion stated that voting offers a change for people to contribute to decisions that can affect their communities and directly or indirectly impact their health and well-being. And other groups, many of which are our colleagues, such as the American Academy of Pediatrics and the American Public Health Association, the AMA, are also in support of these statements. And so, we know as healthcare professionals that voting can directly influence health equity. And there is evidence now, evidence that came out about 4 years ago in 2020 from Daniel Dawes. It was published in the Johns Hopkins University Press. It's called The Political Determinants of Health. This is a framework that talks about social drivers that are influenced by policy and politics. So things that we consider part of our built environment, things such as, where we live, how we get around, if our neighborhoods are safe, if we have access to fresh fruits and vegetables and healthy foods. These, quote unquote determinants, political determinants in this framework can greatly influence how resources are distributed, and it can either deepen health inequities or it can advance health equity. And so we know that voting leads to the establishment of elected officials who then are responsible for policies that indirectly or directly influence these political determinants of health. And so voting is the first step in this framework to really think about the built environment. And that's something that we think about so often in our work as healthcare professionals. And so much of the built environment and social determinants of health influence the overall health and well-being of the kids and families that we're serving in our communities. So we know that voting is linked to health in a variety of ways, but there are lots of things that we can do to encourage voting and talk to our patients and families and communities about why voting can really influence their overall well-being. So one, voters have the opportunity to vote for elected officials that will vote on and distribute resources that will directly influence and improve their health. So this might mean a variety of things, whether it means better access to health care, with programs like Medicare and Medicaid. It may mean changing, different factors that influence your health, whether it be, thinking about safety in neighborhoods, thinking about transportation, thinking about access to Wi-Fi for telehealth. There are a variety of different issues that elected officials are voting on that have direct links to the health and well-being of our patients. And so voting, obviously influences that. And so when we're talking to, folks in our clinics and our health systems, one of the things that we can do is, talk about how, voting really can influence the distribution of resources. Another thing to think about is that voting can also, increase communities' voices on initiatives or referendums that are added on ballots that may, again, either directly or indirectly influence health. And so particularly at the state and local level, there are oftentimes initiatives and referendums that, have direct impact on health, whether it be, again, through, those kind of political determinants of health around, where you live, transportation, safety, allotment of resources for parks and places to walk walk and play, or it may be, things at the state level around, women's rights and a variety of things around healthcare and that realm that truly do directly influence health. And this topic is a bit tricky because when we're talking about voting, one of the things that we want to remember as healthcare professionals is that we're thinking of it under the lens of a nonpartisan topic. And so we're neither Republican or Democratic or any type of party affiliation, but really thinking about how just the act of voting, whether or not you're voting for one political party or another, can truly impact the overall health and well-being of individuals. And also, just the idea of voting and civic engagement is really important to emphasize to families and communities. And so, one of the things that is important to remember is that there's evidence that shows that voting is linked and civic engagement is linked to better health. And this has been something that's been referenced in the Robert Wood Johnson Foundation and Culture of Health Action Framework. It really highlights the value in civic engagement. And so, just that process of feeling empowered to vote about topics that are important, feeling empowered to vote for individuals who they feel like, will really influence their overall health and well-being can have major implications for health. And these, and a lot of studies have been found to not only be correlational but causal. And so that there's real value and power in that. Again, when we're thinking about this, there's complexity with partisan lines, and thinking about how we frame it is really important when we're talking to the communities that we're serving. And I think a really helpful way to think about this is to think about the historical context of how voting has influenced the overall health and well-being over the years of many Americans. And so as we think about how we've increased diversity in our voter registration, we've seen, significant changes in the overall funding and resource allocation for a variety of initiatives that really influence children's health. So, when we're thinking about just access to healthcare, when we're thinking about access to vaccinations, and when we're thinking about programs such as Medicare and Medicaid and the development and expansion of those, from the 1920s on, there have been a lot of different examples where we've increased diversity in our voter base that also has led to an influence in who is being elected and that resource allocation. And so I think that that can be really exciting when you're talking to the families that you're serving and the communities that you're serving, to say, you really do have a voice and your voice matters, and hear examples of how, voices have changed how we're delivering care, over the last 100 years. So something really to think about and share. One of the things that you can do as you're thinking about how you can approach these subjects with, both the communities that you're serving, but also your colleagues, is, to think about organizations that are also committed to doing this type of work. There is an organization called Vote ER or Voter that is a nonpartisan nonprofit group that helps hospitals and clinics and health systems build conversations around voting and civic engagement. And so that website, Voter, and we can link it in this video. It can be incredibly helpful when you're thinking about just encouraging people that you're working with and the communities you're serving to just register to vote. And just having conversations in your offices around, are you registered to vote? Do you have a way to get to a voting site? Can you request an early ballot? Do you need help requesting ballots? All of those questions can be a really wonderful segue into just empowering individuals to vote. There are also formal organizations within lots of communities, both at the state and local level, that really encourage voting. So no matter if you're looking at a national organization like Vote ER, or if you're looking for resources within your local communities. There are lots and lots of wonderful organizations who are really committed to just encouraging the act of voting. One of our focuses tonight was to really make the link of voting to health equity, as well as just overall health outcomes. And so again, as you're talking about this with families, with colleagues, thinking about how you can emphasize that who you're selecting for your elected officials greatly influences the overall political determinants of health and resource allocation, and what that means for you and your communities, as you want to select people who are focused on the same initiatives that you are, and the values and things that are important to you as a healthcare professional, as someone who is improving the overall health and well-being of communities, is something that we want to think about when we're talking to our colleagues. And interestingly enough, even though we know that there's a direct link between voting and health equity, and voting and overall health outcomes, the health professions have a significantly lower rate of voting than other disciplines across the United States. And so as healthcare professionals, we really need to do a better job of voting ourselves. So talking about encouraging, voting within your offices, within your health systems, within your universities, is really just as important as talking to the patients and communities that you're serving. There are other groups like Healthy Democracy, Healthy People, the Civic Health Alliance, lots of groups that are working to improve the healthcare workforce to vote. And so when you're looking for resources, that also is something that can be really, really helpful. So as we're thinking about how to move forward, one of the things that you can do is just simply have the conversation and ask the question: are you registered to vote? Or if you are eligible to vote and registered to vote, can you get to a voting poll? Do you need help with a ballot? Do you need help requesting one early? Do you need help with transportation? Do you have questions about your elected officials and where to find information, or where your precinct is? Just basic questions like that can really empower individuals. And oftentimes voter participation is hindered by something as simple as not understanding how to register to vote, or not finding the time to do it if you're in a busy clinic and you're in the office all day long. And so requesting those early ballots and making sure that people feel empowered is the first step in really encouraging civic engagement and thinking about how we can improve the overall health and well-being of the communities we're serving, and also elevate ourselves as a profession. And so I hope that you can find time over the next few months to have some of these really crucial conversations. I hope that you can take a minute to look at the National Association of Pediatric Nurse Practitioners website. We have information and links that can be very helpful if you're having conversations around voting and need help sending someone to get registered to vote, or to explore opportunities within your own communities. And I think another really important piece in this is you're thinking about talking about the power of voting and what that means is that so oftentimes, particularly in a year like this year where we're focused so much on federal elections, we forget about the importance and value of state and local elections. And there's also a tremendous amount of value, and thinking about who you're putting into your local council, your local school board, your local health boards, and so really emphasizing the power of voting within your local community, within your state, as well as the federal level, is an important topic, an important point, and really showcasing that the voting that is being done at the local level can have direct impacts on if you have, a bike path outside, or if you have a farmer's market come to your community. Those, again, political determinants of health that we know, mean so much to the overall health and well-being of the communities we serve. So, as we wrap up, please know that we're here to support you in any way we can to, have these crucial conversations, to provide you resources within your communities and within your clinics, to empower people to vote, and understand that voting has direct links impacts to health outcomes, as well as the overall health and well-being, just being empowered to be a part of something bigger than yourself. So thank you all for listening, and I'll open it up for questions. Maybe we could start by just asking where people are tuning in from. It looks like there are a handful of viewers. So I'm in Louisville, Kentucky, but where's everyone else? Maryland, Kansas City, Connecticut. So we've got Midwest and East Coast. Any questions about what we, have kind of hit on as far as the high points of voting and its value? All right. Well, if you have any questions, please feel free to reach out to health policy at napnap.org. And thank you. Yeah, big shout out to the Health Policy Committee. The National Health Policy Committee has been, working on creating awareness around just the importance of voting. We'll have a child health policy learning call next week, also talking about voting, and have put out some information on the Inside the Beltway that you can also read about, again, with information just on resources, organizations that may be helpful, and again, just having this important conversation and the importance of that. So thank you so much for your time.